First up is Lisa Chambers. She's one of our panelists, and she is an executive national consultant for A Second Chance Incorporated, and she previously worked for the Allegheny County Department of Human Services, Office of Children, Youth, and Families, OCYF, for over 20 years. In her current role, Lisa strives to educate and empower child welfare jurisdictions on the importance of utilizing kinship care services to keep children safely within their own family units, which has positive outcomes for children and families involved in the system. Don't we all know it? And then regarding her community leadership, Lisa volunteers with her church and serves on the board of directors with Black administrators in child welfare. Welcome, Lisa. Thank you for being here with us today.
Thank you.
And we have Robert L. Matthews, who is the Chief Program Officer of Think of Us. In this role, Robert shapes and executes the organization's overall programmatic strategy. He has nearly 2 decades of experience driving system innovation and improving outcomes for youth and families impacted by child welfare services. He's held administrative leadership positions in Tennessee, Maryland, and most recently as director of the Child Welfare Agency in Washington, D.C. He has provided technical assistance at the Annie E. Casey Foundation and supported reform initiatives in Ohio, Pennsylvania, Rhode Island, and the list goes on. So esteemed child welfare professionals with us here today. As a state level administrator, Robert has led nearly every aspect of child welfare services programs, including child protective services, foster parent recruitment, case management, family finding, crisis response, and jurisdiction-wide continuous quality improvement. Welcome, Robert.
Thank you. Glad to be here.
And for us, we really wanted people who have backgrounds being in the field, doing those direct services, practitioners who have years of knowledge and expertise, because in my opinion, you all are the ones who have seen firsthand what it is our families need and what systems may be missing, where they may be providing the best services, but also where they may be falling short. And so we want to definitely ground today's conversation in that knowledge and expertise. So I will turn it over to Lisa.
Well, good morning again, everyone. My name is Lisa Chambers, as Tashira has already talked about. I am a consultant with A Second Chance, and I wanted to talk a little bit about A Second Chance and the services that A Second Chance offers. A Second Chance was established in 1994 by our fearless leader, founder, president, and CEO, Dr. Sharon McDaniel. She responded to the call of a need at the time in 1994 during the heighten of the crack epidemic. And families were coming to the child welfare system, more specifically, African-American families were coming in high droves and being disproportionately involved in the child welfare system back in 1994. And families at that time, we were using the term diversion. Families were being diverted. Grandmas were stepping up and taking care of their families, but they were not receiving the necessary supports. And so A Second Chance was established, one, to be able to assist and to meet birth parents and the caregivers' needs, as well as the children's needs. And since that time, our corporate office still remains in Pittsburgh, Pennsylvania, but we have a regional office in Philadelphia, and we also have a regional office in Concord, New Hampshire. A Second Chance was birthed really to look at how do we begin to change the trajectory for children involved in the system, and for children to be able to maintain their cultural identity and their relationships with their birth families when they have to be temporarily relocated from their parents and placed with relatives. And so A Second Chance was able to provide their supportive services and helping relatives get through the licensing process following the same standards as traditional foster care organizations and the regulations. And over this 30-year period of time, A Second Chance has been able to service over 40,000 children, more than 32,000 birth parents, and over 28,000 kinship caregivers. So today you are certainly going to be in for a treat and hearing more about how hidden foster care and how it evolved and why we are still having this conversation even 30 years later. I will turn it over to Robert to speak more around Think of Us.
Thanks, Lisa, and good morning to everyone. We consider ourselves a research and design lab as we've done work around research in a number of states. And what that could look like, it could be having focus group surveys, could be doing qualitative research in the areas of our 3 pillars, prevention, kinship, and transitioning age youth. We've been able to reach literally over 50,000 people with lived experience. Our work is really centered around their voice, to ensuring that their voice is at the table. It's ensuring that their voice helps to inform policy, whether it's both at the federal level and at the state level. We've been able to utilize their voice and their participation in really driving change and reform in public child welfare agencies. We also help to look at policies, which, of course, we're talking about here in foster care, both some of the harms, but also the things that need to happen to better support children and families. And we're extremely excited to be partnering with A Second Chance. And I'm excited to host this both with Lisa. And we just look forward to having a great discussion, and hopefully then there's something that will be said or done today that will help to bring more knowledge to the field and also better ways that we can support children and families.
So as we move into it and really define what is hidden foster care, the common term right now is hidden foster care. In the past, we used to speak to it around kinship diversion, foster care diversion, or some jurisdictions just use the word diversion. But nonetheless, just to level set and get us all on the same page, we really want to define what is hidden foster care. And we want to use the definition that Joshua Kagan has come up with. It is a legally undomesticated process through which state agencies effectuate a change of custody for thousands of children with little or any due process being done. State agencies thus coerce a surrender of fundamental constitutional rights with no lawyers or legal checks. This action and what happens to the children and the family subsequent to this removal, this action is hidden from the courts because the agencies file no petition alleging abuse or neglect. Which is of concern is because the family's attention came to child welfare because someone made a report as it related to abuse and or neglect. But the decision was made to allow the family to come up and make their own decisions without the system supporting them. What we really want to talk about is how do we distinguish, because in his definition, he's talking about being coercive. And so how do we distinguish between something being coercion, getting people to agree to something, versus there being a lack of transparency by the department? So I will offer that coercion is essentially when someone is intentionally exerting their power and authority over a person and using idle threats of taking an action without giving them the opportunity to have a full understanding of what their rights are. And so when you come to the child welfare system, you have a right to make a decision about your children. You have a right to have due process. But if that is not fully explained to you, then you are coerced into making decisions that may not be in the best interest of your family, because things are couched as, do you want to get deeper into the system? No, we want to empower families. And so we allow you to make decisions about what's best for your family. But we don't give the extra information that there will be no supportive services to go along with this decision in which you have made. There will not be a path in which the child will be able to return because there is no one holding the department accountable to reunification efforts. And so families are under this auspices is that, yes, they're making decisions and that they are in control of their lives, but they're exiting without the ability, knowing that there are other options that would be able to help them, such as preservation services. That is one of the most elementary things in child welfare, is that we are supposed to, from the onset, look at ways on how we preserve families. And preserving families is ensuring that parents remain in the care of their parents. And how is that done? If we do not give the full disclosure of preservation services, giving people the option to choose the preservation services versus the option that if you don't do this, or if you choose this form away, that means the state, right, is going to take custody. So that sounds like something for me as a layperson I don't necessarily want. I don't want the state to take custody or be involved with my family. So we take the alternative, and that is to have the child placed with grandma, aunts, or uncle, or even fictive kin outside of the system, couching it as families had made this decision for themselves. But that decision was made without the full transparency. And so when I look at lack of agency transparency as it relates to coercion, coercion is being forced to do something with lack of information. Lack of transparency is that they give you enough information for you to still say, well, that's not necessarily what I want for my family, but we don't give the full disclosure that if you decide to move on and place with grandma outside of our intervention, there will be no court oversight. There will be lack of services. You will be responsible for the children and youth financially without a system. There may be other concerns that may arise, and you need services because the children have gone through some sort of trauma that's not available to you. So that's a lack of transparency versus being coerced to follow a plan that may not meet the family's needs. So the danger is that families can be further harmed by encountering child welfare and not being able to make sound, informative decisions by information that's communicated to them as far as their right to be heard before court, their right to have a petition filed before the court, that the state will have to prove that they are unable to provide the necessary protective services of their child. And so these are things that we really want to move from. So states not providing this full disclosure, it's basically infringing upon parents' rights as well as children's rights, because kids have rights as well. And every parent has the right to make decisions that are in the best interest of their child. It also is a removal in which the agency cannot do without it being sanctioned by the court. And that by itself is why it's hidden, because the court is unaware that this action has actually taken place. Families are left without the needed services, and there is no real custody arrangement. And so that relative who have stepped up to become the placement source is out there trying to figure out how do they then begin to get children enrolled in school if they live in a different school district. They're also left to figure out how they're able to receive TANF benefits when there is no order showing that this child is placed into their care. And so they're left trying to figure things out on their own without the system to be able to help them get connected to the necessary services, even those services that are in the community. And so when we look at the data is not really being fully collected in the child welfare space, because we can't really tell how many children is in this thing that we call hidden foster care. And so we will be talking about how we can look at this better, how we can better serve families to be able, while child welfare may not be the space for you, but you should be able to receive the necessary services so that families become healthy, so that families are not just surviving, but thriving, and that they receive all that they need to be able to be whole, so that children are not even removed from their parents, but that children are preserved within the families. And one of the ways in which we do that is in many jurisdictions across the land, there is something that is called safety plans that are looking at the immediate threats of children. And I will toss the baton over to Robert to begin to talk more about how safety plans can be used as a mechanism to ensure safety of children and for children to be preserved within their family units.
Thank you, Lisa. And I hope everyone really took in the context that Lisa was providing, because having done this work for a number of years, we've heard these terms, hidden foster care, we've heard shadow foster care, we've heard diversion, and they all mean something different depending on your jurisdiction. And then you also heard us speak about coercion versus an organization not providing full transparency or disclosure. And so I've seen both. I've heard of both. I've heard where staff would have a case And because it's easier, they would then make a decision for the family, not involving different stakeholders or different supports that the family could utilize because it's easier. Well, I've also seen where there are jurisdictions that have full disclosure, talk about, all of the options that a caregiver or a relative might have. And then I've also seen where there are states who have pro bono kind of legal aid services that can help, really provide the pros and cons depending on decisions that relatives may take. One thing before I get into safety plans is for everyone to understand is that there's one thing to have full disclosure and have options, but it all starts with that call to your central intake or to your hotline. And when that occurs, it is incumbent upon the state to ensure, is the child safe currently in the care of their parent? Or could that child be cared for by a relative? And if that's the case, that's when you start talking about options, what's available to this relative, what's available to the family. Because the other piece that's missing is if you by chance don't want to bring the child into foster care, and as Lisa talked about, ensuring that they understand the supports and services that are in place to support the relative, then you have to make sure they understand the pros and cons. If they do assume custody of this child outside of the state assuming custody, one way to do this is through safety plans. And for many of you who work in child welfare, you know what safety plans are. But the question is the efficacy of how they are implemented. They are meant to be temporary and short term. So it is an agreement that details how threats will be managed to mitigate or eliminate together the child's risk of being unsafe. I've seen in some states where safety plans are 30 days. I've seen in some states where safety plans are 60 days. And then if it needs to be reevaluated or extended, you do so making a team decision. And you see the second bullet, it talks about best practice involving cooperative engagement with the parent. Because in order for there to be a true safety plan, you should have the consent of that parent. That means that parent is agreeing. That means that for whatever reason, we've assessed that it doesn't warrant a formal removal of this child from the parent, but what are we going to put in place to address the immediate safety threats to the child? Who else needs to be brought into that discussion, whether it's an aunt, whether it's an uncle, or is it a different service provider in the community? That entire agreement should outline, here are the things that need to happen, need to occur in a certain time frame so that the state feels comfortable that if these things occur, the child can remain safe in the care of either the parent or relative. Maybe this child temporarily can be with this aunt under the consent of the parent and with these services in place. But then the last bullet of that means that the state also is regularly evaluating the content of that plan because it was an agreed upon plan with all parties involved. That means you need to make weekly contact with that family because it is short term, whether it's 30 days or 60 days, because what you want to make sure is that the child is still safe. You want to make sure that there's no further harm to that child. So the state is responsible so long as that safety plan is active. Now, we've also seen where there's misuse of safety plans, meaning that there can be a plan put together, but it doesn't have the consent of that parent. And this is when it gets to what hidden foster care could be. When there's no consent of the parent, but the state or a representative of the state, whether it's a caseworker or a social worker, has basically told this parent, if you don't enter into this safety plan, we're going to remove this child. And I know many of you have heard so many examples of that. We've heard where there are workers that threaten parents or they threaten relatives. You must do this or this will happen. You need to ensure, as I mentioned, that there's regular contact to ensure that the child is safe. And the last bullet in terms of placement decisions, this is an important because the word placement symbolizes a formal process That's why I always talk about the difference between making a placement decision or facilitating an arrangement. If you're making and facilitating a placement decision, that's a formal arrangement. That means that you are involved in the court to solidify a plan because you feel that this child is not safe in the care of that parent. But if you are facilitating an arrangement, that is a discussion between the state, the parent, and that relative with consent of that parent, with consent of the relative, that all parties agree to this safety plan in place. And you're facilitating an arrangement for short-term purposes. Now, the question becomes, what happens if the safety plan is compromised? Then the state has to make a decision that the child may not be safe with that relative, and then with the parent or the relative, depending on what happened. And then the state has to move forward possibly with some more formal processes in place, meaning petition of court to have the child removed. But if the safety plan is successful, the question is, to what extent have these supports helped to reduce the safety threats to where if these supports are ongoing, the child can remain safe either with the parent or with their relative? Let's advance to the next slide, please. I want to briefly talk about voluntary placement agreements. And as you can see, the definition, it's when a parent voluntarily chooses to place the child into foster care, in parentheses, temporarily without the need of a court order. And again, voluntary placement agreements across the country look different. There's some voluntary placement agreements that have a time frame of 60 days, 90 days, 120 days, 6 months. There are variations of time frames. But here's the purpose of a voluntary placement agreement. It allows that parent to work with the state for the child to be brought into foster care, but the sole purpose is to ensure that there are services and supports that are put in place. And here's the kicker. It also does not substantiate the parent for any abuse or neglect. That is the key point here, because we don't necessarily want to penalize parents, especially if they come to the table to show that they have made diligent efforts to keep their child safe. They made diligent efforts to put in services, but they just haven't worked. And the system probably has failed. And so the parent has a say because their parental rights haven't been stripped from them. They have a say in some of the placement decisions. They have a say in some of the supports. The state may work with the parent to ensure that at the end of this voluntary placement agreement, and again, the intended benefit is to be short-term to ensure the child receives services. The state and the parent enters into this agreement, and again, it does not require a court order. It requires ongoing parental involvement, and this part is also important. Similar to the safety plans, this plan has to be reviewed on a weekly basis just to ensure that the services are in place, because we know that there can be waiting periods for children to be served or for families to be served. So we want to make sure that the referrals have been made. We reached out to the provider can see the kid and the families, right? But the goal is to coordinate these services to prevent formal foster care.
Yes, and so one of the things that we really want to offer up, because we have the blanket voluntary placement agreements, but we really want to lift up a kinship voluntary placement agreement, because now the agreement is not just between the parent and the state or the county, but the agreement is in relationship to the parents, the caregiver, and the state, that everyone is agreeing to specific terms during this time in which the parent is working on whatever they need to work on to mitigate the factors that brought the family to child welfare's attention. And so we really will have to go back, each jurisdiction will need to go back and assess their data to really look at those families that are coming in that you may have done a formal removal on, but I like to call them short stayers, where they were not involved for a very long time. They were involved anywhere between 30 to 90 days. And so was the formal removal necessary? Or could there have been a voluntary placement kinship agreement put in place so that the parent could work on whatever they needed to work on to stabilize The child is then moved with a family member for this short period of time and then returned to the parents without needing the court involvement. So, Robert, can you speak a little bit about the Senate bill that will be coming forth?
Sure. Lisa, you spoke about earlier that it's very difficult to bring to the forefront how many families actually might be subjected to this type of practice, whether it's coercion or whether it is the state not providing full disclosure to relatives. And one way I believe this bill is going to be helpful in terms of looking at how you really begin to evaluate, track, and monitor when this happens. And it should happen really at the forefront of entry in terms of that first call to central intake, the first interaction they have with child protective services. Because the first point that has to happen before any of this occurs is that there has to be an assessment of the family. You have to assess, is that child safe or not in the current care of that parent? And if they are, then the child welfare organization has a menu of options they can do. We just talked about it. Safety plan. If the child can be safe and safety threats are not high, depending on the type of risk assessment you use, you can opt to use safety planning as a tool. But we just want to make sure that you follow through the best practice of how to effectuate that. But if you assess that the safety threat is high to where the child may not can be safe with that parent, then you have to ensure that that parent is clear on their rights, clear on the options, right? Because what this bill will hope to do is to also, as jurisdictions are now looking at their new child information systems that are required for them to do their SACWA systems, is more transparency in the data. So that we know, as you can track how many families are coming to the attention of the front door, what buckets and what pathways they're following. Because it's either going to be, are you going to provide in-home family preservation services? If that child is not safe, that child is going to come to foster care. Or is it going to be this prevention route, which has to be fully built out more? So basically, it's really hoping and aiming to provide more transparency so that we can really understand across the board how often this might or might not be occurring.
And I will also offer that in this data collection, you really have to de-aggregate the data to really look at what populations are being affected the most and where the disproportionality is coming in, because we cannot be oblivious to societal forces, structural racism that are happening in systems that are impacting marginalized communities. And so decisions are not often made in their best interest, as I stated before, to be able to make informed decisions. And so we have to make sure that as a system, that we are breaking down these barriers. Because oftentimes we say we go this route outside of the system because the families cannot pass the background checks. Well, that is the furthest from the truth. As one may have had or may even have a criminal record, not all charges are excludable. And so families still should be considered as that option for that youth. And so we really have to look at the impact of what barriers the system is putting in place for children to be able to thrive within their families. Because there certainly is a difference between surviving and thriving. And we need to get to from a child welfare system to a child well-being. I will offer a family and child well-being system. And so some of the things that we are offering you as some of the resolutions, whether the family believes formal should be the route, but they have the power, because no one knows the family better than the parents. But we cannot discount the parents. And oftentimes that happens, that we are not hearing from what the parents are saying their needs are. We develop plans that meet the needs of the system, not the needs of the family. So how do we begin to shift that so that the children have an opportunity to meet their potential through the lens of their parents and their parents' ability to provide the parenting that they know how to do? But this was just a segment and a bad decision that may have occurred that led them to child welfare. So I'd like to leave it like it's a segment in someone's life and not their whole life story.
Thank you for that. Robert, any concluding thoughts or responses before we jump into Q&A?
Sure. I mean, this is a very thorny subject. I want to be very clear. It is a hot button issue, and we know that is occurring, and it also is occurring in different variations across the country. And, one of the things in having done this a long time is that I'm very careful, and Lisa knows that. I am personally careful of using the word coercion, because that will require me to know kind of, what's in the mind and the heart of a worker in terms of threats. But when there is evidence that shows that they have been threatened, and rightfully so, people are coercing families into making decisions. And then there's a piece where I also understand where workers may not be as fully informed and or trained to explain options to relatives. And I think that is an area where across the board, we can do a better job. And if jurisdictions don't feel as though their workers should be doing that because they might consider it to be providing legal advice, then contract with a legal aid who has the expertise that can do that on the front end. And I think that will help solve a lot of issues that jurisdictions may have in terms of families not being provided full disclosure of their options. But I've also seen where it's successful in some states like Tennessee, where workers are very skilled in having that conversation with relatives and helping them make informed decisions.
Thank you, Robert. I want to get into also more about reunification. One of the most troubling aspects of hidden foster care is the significant barriers it creates to family reunification. And we have quite a few people in the chat today who are saying, I actually personally am having that experience, or I've been fighting for years, or I finally got my kids back. Can you say more about the barriers that hidden foster care is providing versus maybe a traditional placement?
Well, the barriers that hit in foster care is because people believe that they're under a mandate. And so while they're not, parents can really go and get their children. But there's the fear of, if I do that, now an action is going to be filed against them for the lack of protecting the child. But that's the danger in hidden foster care, that there doesn't really allow a pathway for the child to go home. And there's these safety plans that have expired, but people are still under the mandate that they're under the safety plan. Safety plans are to be used for time-limited purposes, but people are exiting the system on safety plans that they believe are binding, that are not binding. And essentially, parents can go and get their children. But it still leaves a gap in the services that the parent may need if they have not received what they needed to be able for the child to return home. So that's the big barrier. Has the parent been able to receive the services that they need so that the child can be returned to their care? But there is no pathway or formal way to return in this situation of hidden foster care because the court has not provided oversight. And essentially, when you look at it from a layman's eyes, the parent still has the right to the child, and that the child is really actually living with the parent, but that's not the case. And so this is where the child welfare representative has to make sure that there are not closing cases where children have not made their way home. And if you have gone beyond the time limit of the 30-day, 60-day, whatever your safety plan is, or whatever your voluntary placement agreement is, then you must legally file that action before the court, because that is what the family was told, and that was not what the family received. So we're doing a disservice.
Don Wells, Just in Time San Diego, says it all starts with mental models that drive policies, practices, and behavior. If the mental health model starts with broken families, that leads to what's being done now. If the mental model that starts with under resources, under supported families, that leads to different actions. So it sounds like he's saying,
I could get with that.
how do we focus more on the systems improvement than trying to fix broken families? And Robert, I know you talked about workers and how we can resource them the best. I saw in the chat someone said, what workers are not being paid a livable wage or not being paid what they should be paid given the area of responsibility that they have for our families. They are being under-resourced. How do we create a stronger child welfare workforce and give them what they need so they can best serve children and families?
Thanks for that question. And I want to say this too, because I think, as we are going to have kind of this 3-series part, I want to be very clear that I am not promoting like there is a one way to do this. And the reason I want to say that is because each state is different in geography, and it's different and demographically. I think what we're proposing here are best practices that can be put in place, right, to help support families. Based on that comment, I always start from a values perspective. Do we want to ensure families stay together? That's the first question you should ask yourself, because the child welfare system is built and developed to do the opposite. I want to be very clear about that. It's built to do the opposite. That's why I don't agree when people say, when the question is asked, is the child welfare system operating well? I will be like, it absolutely is. We are operating very well. We separate children from their parents. We break families apart, whether you like it or not. So now really what I see having a sea change is if we really begin to look at how we can better keep families together, it would make us think a little differently, because it does start with safety. Can that child remain safe in the parent's care? If that question is no, then that's what the formal system was built for, to protect them. The only difference is we're not looking to place them with a stranger. We want to place them with a relative. They are stepping up because they care and they love this child. But guess what? They also need the support to do that. That's really what we're preaching today in the church. We want to be able to support these relatives to care for these kids when they are unsafe with the parent, right? So I actually don't want to continue, as I think we said in the beginning of this webinar, to have this same discussion next year. It's not rocket science. It's either we're going to support families or not, right? And if we support families, that means that we know children get the benefits of foster care, whether it's education, mental health, all of that. But the prevention model needs to also align and have parity. If you want to prevent foster care, you have to provide the same level of supports. And that may also require the federal government to figure out, as Lisa said, how to fund it. And if they can't fund it, then you might have to get with your executive leader, whether it's a mayor or whether it's a governor, to say, hey, we're going to use our local dollars to figure out how to support these families. The data shows that if you support families outside of foster care, how much cheaper it is, right? Kids are still better off, but we need to have parity between both pathways, both systems. So I'm a proponent, support families.
I would say, Robert, that's why we talked about going more upstream. It's because if the prevention services were in the community, families would not even have to come to the doors of child welfare.
Absolutely.
Because there would be services that they can access within their community.
Yeah, and I love this topic of parity, right? So that we can end this family policing, we can abolish this family separation system and really get to a system that is around child well-being, as Lisa has said. And so I guess my question is, how do we get there? That's the $1 million question. That's what we're going to be talking about in this series. That is the root of the issue, essentially, because while advocates for years have been saying the child welfare front door needs to be narrowed, and we know this because of the myriad of resources around racial disparities and disproportionality, and the numbers of families who are involved in the system ballooning. It is now shrinking, but it should not be shrinking on the backs of these families who are not being served. So how do we get there? Isn't that what Family First was supposed to do, Robert? First Prevention Act was supposed to help us with that?
It's a start. I think everything starts with, kind of foundationally. It's a start. And again, we hope that child welfare is a field where it can be nonpartisan, but let's just be very clear, it isn't, just like most things. And so when you look at a bill, you have to look at, okay, how do I get both Democratic and Republican support? And it may not be everything that we want, but it's a start. That's why we have to continue to build on it. But how do we get there is this, and I want to give Lisa an opportunity within the 6 minutes we have left. I'm going back to values. If there's a relative that's willing to step up to care for a child, point blank period, it is simple. Give them the support, financial support, the community-based supports that they need. What we have as an issue is that anything tied to money that gives a relative money to care for a child that's related to them is seen as an entitlement. It's seen as an entitlement to say, oh, okay, well, they're going to be so dependent on this subsidy every month that guess what? This child is not going to go back home. Well, guess what? The child may not need to go back home. They may need to stay with their relative. But we got to begin to shift our thinking, just not to think that, these dollars that you provide a relative, that they're just going to go and squander, because no one's really going to say that. We don't think relatives can make the right decisions. And what it really gets down to is a lack of trust. We don't trust people to make the right decisions for children. And if we learned anything from the pandemic, whether people like it or not, people made the right decision when they were given extra dollars to do so. They cut child poverty in half. So we have to begin to trust people to do the right thing, but we also have to fully disclose, give them the options, and fully support them in the way they need to be supported to care for these kids. Lisa, I'll give it to you.
No, I wholeheartedly agree with what you're saying. And we have data over 30 years from a second chance that families do the right thing. And they are receiving financial support along with other supportive services. And our data shows that children are faring well and they are not returning to the system. We have our data to show that in Pittsburgh, in Philadelphia, as well as New Hampshire, that they are not re-entering the system once they exit. So families are doing right by children, and we are providing those supportive services. And that's why we are a proponent and a testament of that. When families receive what they need, they protect the children go home and are less likely to re-enter the child welfare system. We have 30 years of data to prove it.